Hello students, welcome to the lecture on human development, and after this lecture we will be able to learn the following objectives. Discuss human rights and health, explain how WHO works on health and human rights, describe human development. Let's start with what human rights and health is. Promoting and protecting health and respecting, protecting and fulfilling human rights, which are inextricably linked, and every country in the world is now party to at least one human rights treaty that addresses health-related rights and the conditions necessary for health. The United Nations Universal Declaration of Human Rights recognizes that everyone has the right to a standard of living adequate for the health and well-being of himself and of his family. The WHO Constitution. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. The world needs a global health guardian, a custodian of values, a protector and defender of health, including the right to health. Dr. Margaret Chan, Director General WHO. Every country in the world is now party to at least one human rights treaty that addresses health-related rights. This includes the right to health as well as other rights that relate to conditions necessary for health. The role of the Health and Human Rights team is to strengthen the capacity of WHO and its member states to integrate a human rights-based approach to health. Advance the right to health in international law and international development processes. Advocate for health-related human rights. The human right to health means that everyone has the right to the highest attainable standard of physical and mental health, which includes access to all medical services, sanitation, adequate food, decent housing, healthy working conditions, and a clean environment. The human right to health care means that hospitals, clinics, medicines, and doctors' services must be accessible, available, acceptable, and of good quality for everyone on an equitable basis, where and when needed. The design of a healthcare system must be guided by the following key human rights standards and principles. Universal access. Access to healthcare must be universal, guaranteed for all on an equitable basis. Healthcare must be affordable and comprehensive for everyone and physically accessible where and when needed. Availability. Adequate healthcare infrastructure, example, hospitals, community health facilities, trained healthcare professionals, goods, example, drugs, equipment, and services, example, primary care, mental health, must be available in all geographical areas and to all communities. Acceptability and dignity. Healthcare institutions and providers must respect dignity, provide culturally appropriate care, be responsive to needs based on gender, age, culture, language, and different ways of life and abilities. They must respect medical ethics and protect confidentiality. The human right to health also entails the following procedural principles which apply to all human rights. Non-discrimination. Healthcare must be accessible and provided without discrimination in intent or effect based on health status, race, ethnicity, age, sex, sexuality, disability, language, religion, national origin, income, or social status. Transparency. Health information must be easily accessible for everyone, enabling people to protect their health and claim quality health services. Institutions that organize, finance, or deliver health care must operate in a transparent way. Participation. Individuals and communities must be able to take an active role in decisions that affect their health, including in the organization and implementation of healthcare services. The human right to health is protected in Article 25 of the Universal Declaration of Human Rights, Article 12 of the International Covenant on Economic, Social and Cultural Rights, Article 24 of the Convention on the Rights of the Child, Article 5 of the Convention on the Elimination of All Forms of Racial Discrimination, Articles 12 and 14 of the Convention on the Elimination of All Forms of Discrimination against Women. The human rights approach to public health systems development has been a central theme to emerge from the unprecedented growth in funding for global health in the last 2 decades. The notion that healthcare systems are public goods protecting the essential rights of all citizens, while not universally embraced, is increasingly invoked in debates about healthcare financing, governance, and implementation. In this chapter, challenges in translating the emerging consensus around health as a human right into one particular aspect of the right to health are explained, namely, access for the most vulnerable to effective healthcare systems. The private sector cannot by itself guarantee the health of the poor, whose right to care and cure is so routinely violated. The private sector can sometimes deliver dignified care to significant segments of the world's population, especially when private corporations are partners in innovation. One has only to contemplate the development of novel diagnostics and therapeutics to see the potential of the private sector. But it is not the task of the private sector, whether not-for-profit or for-profit, to guarantee access to health care for the poor or otherwise marginalized. These tasks, which include basic regulatory obligations and also ensuring access to services, are necessarily the task of government. Every country in the world is now party to at least one human rights treaty that addresses health-related rights, including the right to health and a number of rights related to conditions necessary for health. The WHO is actively strengthening its role in providing technical, intellectual, and political leadership in the field of health and human rights. Promoting and protecting health and respecting, protecting and fulfilling human rights are inextricably linked. Violations or lack of attention to human rights, example, harmful traditional practices, slavery, torture and inhuman and degrading treatment, violence against women can have serious health consequences. Health policies and programs can promote or violate human rights in their design or implementation. Example, freedom from discrimination, rights to participation, privacy and information. In seeking that something else, human development shares a common vision with human rights. The goal is human freedom. Therefore, human development is interconnected with human rights and human freedom because in well-managed prisons, life expectancy and literacy as measured by the Human Development Index could be quite high. And in pursuing capabilities and realizing rights, this freedom is vital. People must be free to exercise their choices and to participate in decision making that affects their lives. Human development and human rights are mutually reinforcing, helping to secure the well-being and dignity of all people, building self-respect and the respect of others. In the days of fast globalization, human rights issues surface in relation to multilateral corporations and poverty issues. The idea of human development stipulates the need for education, better conditions for work, and more choices for individuals. The idea goes with what human rights. The two concepts is simultaneously promoted first by well governance, implementation of human rights policy, and a formation of participation of community in decision-making processes. Second, by the promotion of civil and political rights and economic and social rights, which are components of the level of development. For instance, the right for education relates to intellectual development and political rights relates to the level of the political development of that society. Did you know the FAO supports sustainable natural resource management, including agricultural water use efficiency, land and soil productivity, sustainable forest management, aquaculture and inland fisheries, integrated crop and livestock systems, pesticide management and watershed management. The FAO also supports the major environmental conventions, including the United Nations Framework Convention on Climate Change. With the concern for the growing rise of the population, 1.21 billion, and still growing at the rate of 1.8% per annum, it should be first found out how worried the government was and what is it that it is doing about population control. The Economic Survey 2011-2012 of the Government of India for an update and pleasant realization about the change in perception. The key is to focus on human development, for development is the best contraceptive. On several things, many of understanding and approaches have changed in a very positive way, enabling us to approach solutions to the problems in different ways. For instance, one are no longer using the word disabled but differently abled people. Similarly, the term population would perhaps be forgotten altogether someday, and we shall be speaking of human resources or human capital. Proportion of working population between 15 and 59 years is likely to increase from approximately 58% in 2001 to more than 64% by 2021. According to Economic Survey, in absolute numbers, there will be approximately 63.5 million new entrants to the work age group between 2011 and 2016. What is more, bulk of the increase is likely to take place in the relative younger age group of 25 to 35 years. Such a trend would make India one of the youngest nations in the world. In 2020, the average Indian will be only 29 years old compared to China's 37 and USA's 45 years. This is what is flaunted as demographic dividend, and I agree that it provides India great opportunities for development and fast growth. What is Human Development Report? Can anyone define this term? The aim of the Human Development Report is to stimulate global, regional and national policy discussions on issues that are relevant to human development. To be of relevance, the data in the report requires the highest standards of data quality, consistency, transparency, and accountability. Several steps are taken each year to ensure that the report maintains high quality and reliability. These steps include partnering with many national and international statistical agencies. In this chapter, we will find an extensive array of information to help understand how the data presented in the report indicator tables are compiled and how they should be used and interpreted. The first Human Development Report introduced a new way of measuring development by combining indicators of life expectancy, educational attainment and income into a composite Human Development Index, the HDI. The breakthrough for the HDI was the creation of a single statistic which was to serve as a frame of reference for both social and economic development. The HDI sets a minimum and a maximum for each dimension called goalposts and then shows where each country stands in relation to these goalposts expressed as a value between 0 and 1. The Human Development Report presents analytical tools for policy choice. These tools are amongst the most significant contributions of the report. They provide user-friendly methods for the analysis of human development at the international, regional, national and subnational levels and the means for assessing trends and gaps in human development. The concept of human development focuses on the ends rather than the means of development and progress. The real objective of development should be to create an enabling environment for people to enjoy long, healthy and creative lives. Though this may appear to be a simple truth, it is often overlooked as more immediate concerns are given precedence. Human development denotes both the process of widening people's choices and improving their well-being. The most critical dimensions of human development are a long and healthy life, knowledge and a decent standard of living. Let's further discuss about Human Development Index. The Human Development Index HDI measures the average achievements in a country in three basic dimensions of human development: a long and healthy life, access to knowledge, and a decent standard of living. Data availability determines HDI country coverage. To enable cross-country comparisons, the HDI is, to the extent possible, calculated based on data from leading international data agencies and other credible data sources available at the time of writing. The Inequality Adjusted Human Development Index IHDI adjusts the Human Development Index HDI for inequality in distribution of each dimension across the population. The IHDI accounts for inequalities in HDI dimensions by discounting each dimension's average value according to its level of inequality. The IHDI equals the HDI when there is no inequality across people but is less than the HDI as inequality rises. In this sense, the IHDI is the actual level of human development accounting for this inequality, while the HDI can be viewed as an index of potential human development or the maximum level of HDI that could be achieved if there was no inequality. The loss in potential human development due to inequality is given by the difference between the HDI and the IHDI and can be expressed as a percentage. The HDI was created to emphasize that people and their capabilities should be the ultimate criteria for assessing the development of a country, not economic growth alone. The HDI can also be used to question national policy choices, asking how two countries with the same level of GNI per capita can end up with such different human development outcomes? For example, the Bahamas and New Zealand have similar levels of income per person, but life expectancy and expected years of schooling differ greatly between the two countries, resulting in New Zealand having a much higher HDI value than the Bahamas. These striking contrasts can stimulate debate about government policy priorities. If human development is about enlarging choices, poverty means that opportunities and choices most basic to human development are denied. Thus, a person is not free to lead a long, healthy and creative life and is denied access to a decent standard of living, freedom, dignity, self-respect and the respect of others. From a human development perspective, poverty means more than the lack of what is necessary for material well-being. The Human Poverty Index, HPI, is a composite index of poverty that focuses on deprivations in human lives aimed at measuring poverty as a failure in capabilities in multiple dimensions, in contrast to the conventional head count measure focused on low incomes. The HPI was introduced in the United Nations Development Programme Human Development Report 1997 and concentrates on deprivations in basic dimensions of life. This chapter develops an axiomatic characterization of a family of global deprivation indices using an arbitrary number of dimensions of human life. When we consider only the three basic dimensions, a member of this family becomes ordinals equivalent to HPI. The general index allows the calculation of percentage contributions of deprivations in different dimensions and hence to identify the dimensions whose failures affect the overall deprivation more. This is important from a policy perspective. We also provide an empirical illustration of the characterized indices using cross-country data for the three basic dimensions and the anthropometric indicators birth weight, height for age and nourishment. Rather than measure poverty by income, the HPI uses indicators of the most basic dimensions of deprivation: a short life, lack of basic education, and lack of access to public and private resources. The HPI concentrates on the deprivation in the three essential elements of human life already reflected in the HDI: longevity, knowledge, and a decent standard of living. The HPI is derived separately for developing countries, HPI 1, and a group of select high-income OECD countries, HPI 2, to better reflect socio-economic differences and also the widely different measures of deprivation in the two groups. The first deprivation relates to survival, the likeliness of death at a relatively early age, and is represented by the probability of not surviving to ages 40 and 60 respectively for the HPI 1 and HPI 2. The second dimension relates to knowledge, being excluded from the world of reading and communication, and is measured by the percentage of adults who are illiterate. The United Nations Foundation is committed to helping the UN achieve the 8 Millennium Development Goals by 2015. The MDGs are a commitment by the UN to establish peace and a healthy global economy by focusing on major issues like poverty, children's health, empowerment of women and girls, sustainable environment, disease and development. It reflects the fact that the fates of all people and nations are linked. Unless we can help the world's poor create a better life, no one's prosperity can be secure. Progress towards reaching the goals has been uneven. Some countries have achieved many of the goals, while others are not on track to realize any. A UN conference in September 2010 reviewed progress to date and concluded with the adoption of a global action plan to achieve the 8 anti-poverty goals by their 2015 target date. There were also new commitments on women's and children's health and new initiatives in the worldwide battle against poverty, hunger and disease. The number of hungry people in the world remains unacceptably high despite expected recent gains. The FAO estimates that the number of people who will suffer from chronic hunger in 2010 is 925 million. About 72 million primary school age children do not attend school. Over 4 out of 5 of these children live in rural areas. The urban-rural knowledge and education divide is today's main barrier to achieving universal primary education by 2015. At the same time, the learning ability of rural children is compromised by hunger and malnutrition. Food security and education need to be tackled simultaneously to develop the capacity of rural people to feed themselves and overcome poverty, hunger and illiteracy. The FAO recognizes the importance of promoting the full and equitable participation of rural women and men in efforts to improve food security, reduce poverty and fuel social and economic development. Without rural women's economic and social empowerment and gender equality, food security will not be achieved. Now in the end, let us summarize what we have learned in this lecture. Promoting and protecting health and protecting and fulfilling human rights are inextricably linked, and every country in the world is now party to at least one human rights treaty that addresses health-related rights and the conditions necessary for health. The human right to health care means that hospitals, clinics, medicines and doctors' services must be accessible, available, acceptable and of good quality for everyone on an equitable basis where and when needed. Human development is interconnected with human rights and human freedom because in well-managed prisons, life expectancy and literacy as measured by the Human Development Index could be quite high. Proportion of working population between 15 and 59 years is likely to increase from approximately 58% in 2001 to more than 64% by 2021. According to Economic Survey, in absolute numbers, there will be approximately 63.5 million new entrants to the work age group between 2011 and 2016. The aim of the Human Development Report is to stimulate global, regional and national policy discussions on issues that are relevant to human development. The Human Development Index, HDI, measures the average achievements in a country in 3 basic dimensions of human development: a long and healthy life, access to knowledge, and a decent standard of living.